Starting in the 1990s, prescription opioids were heavily pushed as the best way to treat pain. As we all know, this led to doctors overprescribing the drugs and millions of Americans developing a dependency that's continued to persist to this day. And though we often think opioid exposure stems from broken bones and major surgeries, many people overlook the field of dentistry. A 2018 study in JAMA International Medicine reveals that dentists are the leading prescribers of opioids for children. But it shouldn't come as a shock that these medical specialists have to manage a lot of pain.
So whether it's a toothache or whether it's pain that's caused by a surgical extraction of a tooth, pain often results. And so opioids are one form of analgesics. And so dentists oftentimes prescribe opioids. Now, there has been a reduction in the amount of opioids that dentists have been prescribing. So there has been change in practice patterns, but it hasn't been enough.
That's Dr. Cecile Feldman, Dean of the School of Dental Medicine at Rutgers University. The American Dental Association updated its policy for opioid prescribing in 2018. It supports continuing education for prescribing practices, limits on opioid dosages, and time restraints on drug use for acute pain. However, Feldman says there are still instances of unnecessary prescribing, like after tooth extractions.
Different kinds of extractions are likely to cause different levels of pain. So unless there is severe pain that is expected, and there's some reason why a patient can't take an NSAID or acetaminophen, then there's no reason for an opioid to be initially prescribed. And that's oftentimes what happens. And so we want to try to minimize that from occurring.
Much of Feldman's research aims to inform better standards of care, such as reducing the number of opioid prescriptions. In fact, she was the principal investigator for a new paper in the Journal of American Dental Association that has revealed stunning truths about pain management drugs, also known as analgesics. She hopes this work helps find solutions for a problem that affects so many.
Just about everyone is touched in one way or another. Either it's a family member or a friend who's impacted by, the opioid epidemic. While there have been recommendations for a number of years about reducing the amount of opioids in dentistry, those recommendations are based upon evidence that's considered of weak quality. And so we set out to do a study that would provide a high quality evidence that would truly support the reduction in opioid prescribing.
With the goal of providing the dentistry field more solid evidence, Feldman and her team created a process that differs from many other studies of this nature. They gave the surgeons freedom to perform the surgeries how they normally would instead of making them all conform to one technique, which mimicked real life as closely as possible. And where past research only followed up with patients a few hours after the procedure, Feldman's team followed the participants over the entire post-operative period for multiple doses of pain medication. To start the process, all participants came in with at least one mandibular molar.
So that's a third molar that's in the lower jaw, in the mandible, that is at least partially, if not fully, impacted, meaning it's surrounded by bone, because those surgeries tend to produce moderate to severe pain. And if you're going to do a pain study, you need a pain model where patients, unfortunately, normally would experience pain.
Following the procedure, half of the patients were given a combination of hydrocodone and acetaminophen, while the other group received the non-opioid option of acetaminophen and ibuprofen. The participants did not know which combination they'd received, which gave the researchers an opportunity to measure various factors free of any bias.
The ability to sleep, the ability to continue on with your daily activities like driving, all right? We looked at overall satisfaction. We looked at side effects. We looked at the need for rescue. So if the analgesic that we were providing them wasn't sufficient, we provided a rescue medication. So we wanted to take a look at the need for rescue. And across all of those domains, the non-opioid combination came out as being better than the opioid combination. So very, very strong, robust results.
Even when pain was at its worst in the first 2 days after surgery, Feldman's study shows that non-opioid combination outperformed the hydrocodone.
With regard to pain interference, so being able to perform those daily functions, go to work or to drive, for the first 2 days, again, when pain is normally at its worst, pain interference was much less if you were on the non-opioid. All right, so again, favoring the non-opioid. Sleep quality, much better the first night if you're using the non-opioid. The need for rescue. The opioid group had over 6% needing rescue. The non-opioid group had less than 3%. So it was like 2.88%. So over twice as many people in the opioid group required rescue. And that probably is going to be a surprise to most people. I know it was a surprise to us because most of us carry this bias about opioids being superior to non-opioids.
Though they set out to show that non-opioids could be just as effective, these results completely blow past what the researchers expected. But if opioids aren't the king of pain like we've always thought, why do so many of us still believe there's nothing better? Feldman says that's because pain is relative. Some types of pain still do require the use of opioids, but this research proves that we can limit exposure to these drugs and offer patients a better option in certain situations.
We're looking at pain that's associated with inflammation. So usually when you extract the tooth, there's swelling that occurs. And so the NSAID, along with the acetaminophen, really is pretty powerful in terms of managing that pain. With other kinds of pain, it could be completely different. And so, for example, if you're having open heart surgery, it's likely you're going to need something a little bit more powerful. And the opioids do act in a way that make it so that you really don't care what's going on around you. You really don't care the fact that, that you have pain. So they do act in a different way. So it's not one size fits all with regard to pain management and analgesics.
But for this case and other similar oral surgeries, Feldman's shown that we can reduce opioid prescriptions in favor of less addictive options. And while these results are impressive, Feldman wants to push our understanding of pain management even further by bringing in the component of preconceived biases. Are they so ingrained in us that the outcomes would be different if patients knew which medications they were receiving?
So do we repeat this study or do a similar study that's now unblinded to try to see whether or not we're also able to say, even when you know what you're taking, right, the non-opioid still comes out being better? I don't know if that's the case because we know that there's a very strong placebo effect when it comes to analgesics. So that's kind of a next study that we would really like to do, is to do an unblinded study and see how much that bias really does influence, what happens to patients in terms of outcomes.
Since there's still a place for opioids within medicine, it's hard to say how these results would translate to other specialties, like orthopedics. Feldman thinks it could be helpful in other cases where inflammation is a main cause of the pain, but we won't have a definitive answer until those specialties conduct similar research. You can find more information about Dr. Cecile Feldman and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.